Joining me now is Dr. Paul McKinney. Dr. McKinney is the Associate Dean of the University of Louisville School of Public Health and Information Sciences. He's also a member of the National Advisory Committee on Immunization Practices, which provides official federal government recommendations on the use of vaccines in the United States. Dr. McKinney, welcome to Health Matters.
Thanks very much.
Dr. McKinney, let's start with the basics. Why do we have vaccines, and why should parents immunize their children?
Very good questions. We have vaccines because there are dangerous diseases out there, infectious diseases caused by bacteria and viruses that can cause severe and even fatal infections among people of all ages. And it's important for parents to immunize their children against those diseases to help keep them healthy through the entire lifespan.
I think there's probably a fair amount of confusion about how they work. Explaining this to an audience of regular folk, how do vaccines work?
Well, on a very basic level, vaccines are either products from certain parts of viruses or bacteria, or entire bacteria or viruses that are treated in such a way to render them harmless to the individual, but which produce what's called an immune response. And what that is a production either of antibodies by the recipient's immune system, proteins that attack the true bacteria or viruses if they invade the system, and then rapidly act to neutralize those and render them ineffective if they were to be re-challenged at a later time.
So would it be fair to say that the vaccine stimulates something to happen within the body that then protects the body from future exposure to that particular agent,
exactly,
virus or bacteria?
It generates a response within the body that provides usually very long-lasting protection based on the host or the individual recipient's own immune system response.
We often hear from parents in the community, parents and adults for that matter, concerned that somehow the vaccine that they're giving is going to cause them to have the disease. We most usually hear this around influenza vaccine time when people are concerned that if I take a flu shot, it's going to give me the flu. Is that possible?
It's not possible, fortunately. We've heard that concern expressed many, many times over the years. And in fact, people who get the flu vaccine can get occasionally some muscle aches and pains. They may get a very low-grade fever, and they may feel a little bit uncomfortable for a day or so after getting the vaccine, but that is different than getting the flu. Influenza itself is a much more severe problem. It tends to last for several days. It frequently puts people flat on their back in bed as a result, as opposed to having a minor side effect, which is usually very transient, very mild, and often can be dealt with by just taking Tylenol.
I know the flu is something that everyone is always concerned about, and we're always talking about that. But why do you have to get a flu shot every year?
Every year because the flu virus changes periodically. It undergoes things called drifts and shifts, which basically are changes in its own native viral coat, the material surrounding the virus that allows it to enter host cells. And when that changes slightly, the vaccine that was used in the prior year is not very effective. So the periodic changes, even the annual changes, usually render last year's vaccine obsolete. You've got to get it every single year.
Now, we're primarily talking about children's vaccines and some adult. We notice that, and we hear this from the community all the time. Why is the schedule continually changing? I mean, the things that were on there this year may not be the same as next year, which may be different than the year after that. Why are there so many changes, and why is it important to keep up with this?
Well, there are changes because there are many new important vaccines that are being introduced all the time. And the vaccine schedule keeps expanding as a result of that. It's rare to actually drop a vaccine from the list. One time that's happened in the U.S. is when smallpox was eradicated, and smallpox vaccine is no longer used routinely anywhere, here or in the world. It's only used in situations where biologic warfare might be a concern. So we're expanding vaccines because we have many new vaccines to protect us against diseases that do cause serious illness and that were previously unavailable. So as technology improves, we have new vaccines against common bacteria or viruses that simply were not able to be produced in the past. And it's important, as those come forward, to apply those across the population to reduce the amount of disease, the burden that's caused by them. And
we sometimes hear about vaccines being combined. What is that all about?
Well, that means just putting two or more vaccine products in the same fluid that's injected at a single time. So you don't have to give multiple needle sticks. You're giving a single needle stick with multiple vaccines delivered. And of course, that is an important thing for many children who are fearful of receiving shots or injections. It just makes the process much simpler and smoother and reduces the amount of time necessary to administer vaccines.
Now, we also sometimes hear parents want to know, well, why do I have to start this so early at 2, 4, 6 months? Or why can't I just wait till my child's ready to go to school and then give them all the vaccines at the same time?
Well, if children lived in a bubble, that would be one thing. But kids are always out there among other children that they play with, among friends and relatives and so forth. And there's always the possibility of these infectious diseases, the bacteria, viruses, and so on, being introduced and exposed to them, such that they may get that infection even before they enter school or daycare. So it's important to get them on schedule, on time, because the immune system of children can respond to these vaccines at a pretty early age.
I want to get to this next question, which is a very controversial one. And of course, you know, I'm talking about the question of the relation or the supposed relationship between vaccines and autism. That's probably one of the things we hear the most and the parents are most concerned about. Can you tell us about what we know about that?
Yeah, it's a complicated subject, but I think the short answer is that the largest studies that have been done, the aggregated studies that look at all the investigations across the board on children, do not show evidence that vaccines, any vaccine that we have currently, causes autism. Autism does typically show up in children at around the age when measles, mumps, rubella vaccine, for example, is normally given. It's not, therefore, unusual that people would link the occurrence of autism to receipt of vaccine because both may occur at roughly the same time. But if that were the case, you would expect, in fact, diseases to the two to correlate. You'd see much higher rates of autism, and for example, the thinking at one time was that thimerosal, which is one additive in vaccines, might be causing autism. Well, that product has been essentially eliminated from all vaccines, and yet the incidence, the diagnosis of autism continues to go up. So there's not really a linkage we can find there.
Now, we only have a few seconds left, but can you quickly tell us about adult immunizations? We hear about that from time to time as well.
Also an important question, and adults frequently fail to think about immunizations, considering them to be only for kids. But adults have a new vaccine now for pertussis or whooping cough, because that can cause disease in adolescents and adults. There's a human papillomavirus vaccine, which can be given for adults up to age 26 to prevent cervical cancer. And now a very important vaccine against shingles, or zoster, herpes zoster, to help prevent that disease that can be given at age 60 and above.
Any new recommendations from the advisory committee?
The new recommendations have to do predominantly with things for children, and there have been a couple of childhood vaccines introduced recently. The most important one probably is the rotavirus vaccine, and the other new important recommendation is to give kids flu shots beginning at age 6 months up to age 5 years.
Well, Dr. McKinney, extremely important information, and I know that people are going to be calling us to get more information about this, and we'll certainly refer them all to you because you're the expert. I want to thank you very much for coming on Health Matters.
Thank you
Dr.
so much.
McKinney.
I appreciate it.